You will receive by email your action plan. It will look like this. It will contain a little bit of extra information, but this is the meat of your action plan. So first of all, the question you've answered is about your challenge. So let's see what this person has said is their challenge. So low uptake of COVID-19 vaccine. It comes from many factors and/or situations such as misinformation, myths associated with COVID-19 vaccine, social cultural beliefs. Okay, this to me shows many factors, with some of them listed, is getting specific. This has impacted uptake of routine vaccines as well. To overcome the challenge will contribute to bringing the COVID-19 vaccine pandemic under control in my area. More also, the possibilities of outbreak of vaccine preventable diseases may not occur. I would say this is a decent summary. It is kind of vague. I don't know anything about this person's specific context, about Simon's specific context now, but still, it's a decent overview. I hope it is useful to Simon. Remember, this is not being graded or peer-reviewed, so this is really for your own benefit. I want to understand people's perception and to build their confidence in vaccine to increase uptake. So here there seem to be many possibilities. There's the understanding, that's one, but then there's actually taking actions to build confidence. So better understanding could come through, for example, doing a survey or doing focus group discussions, having an action plan to improve that understanding. If there's already sufficient understanding, but it sounds like there isn't, then the action plan could focus on actually taking actions to build confidence. So you can see here, you have to make decisions. Where are you at with respect to your situation, to your challenge, in order to determine at this point in time, what is the action plan going to focus on? Now, is your challenge too broad, general, or vague, like coverage is too low? Well, Simon has answered, it is specific, I can't take action. Sure, I think there are many things in there. You only want one, ideally, because that is what you're going to focus on. But you're at the challenge level. That's hopefully by the time you get to the goal, you've narrowed it down, you've funneled down, so you can really focus what you're going to take action on. That is the heart of the action plan. Now, Simon has put this under commitment and demand, and then has put immunization in primary healthcare. That kind of makes sense. You should ideally have the same SP for both the general SP and then the key focus area. But I see what he's getting at, because he's mentioned routine vaccination and the impact of COVID-19 vaccination on routine. Is your challenge related to any of these? So, okay. Other outbreaks, I guess that's because he's looking at routine introduction of new vaccines. He's referring to COVID-19 vaccines. So far, I can tell that Simon is thinking through the answers that are being that are being given now. All right. So now is the specific goal. So he does say, I want to increase uptake of routine and COVID-19 vaccine. So he's focused. Sure, that's the overarching goal. The question is, he said that they don't necessarily understand people's perceptions about vaccines yet. So can you launch into that? We'll see what the actions are to see if there's coherence there. Why is this goal important? If I achieve my goals, herd immunity can be achieved in my locality. Also, outbreak of VPDs will be minimum. Sure, that's a logical way of describing why the goal is important. I would have liked to see something about how that relationship with the community, having the community on board and supporting vaccines, having confidence in vaccines is also important and probably supports achieving these two outcomes. Have you started to take action toward this goal? Okay, the no is surprising here, because I'd be surprised to learn that where Simon works. Now, maybe he's referring to himself, in which case that may make sense. Now, stakeholders support an effort of my district director of health services, district health management team, senior colleagues would be well appreciated. Support being financially technical guidelines, strategies would be needed. Barriers, how they may be able to support me till I complete my mission. And if they are unable to support me, I will do what I can to achieve my goals so that my people would be safe. That's a very interesting description of the relationship. For me, it calls up more questions than it answers. But at least the stakeholders identified in the work context, what I don't see is the role of the community. in the plan. Even though the plan is all about them, Simon does not seem to consider them stakeholders. Now, says he needs additional funding. That makes the plan a lot less likely to implement. The plans that are most likely to be implemented are those for which you have locally available resources. And it's really about thinking through what you want to do and how. So this, answering yes to this question, is actually a fundamental weakness of the plan that you will need to address. How much time? 4 to 6 months. Okay, let's look at the actions. It really depends what the ambition is to think through, is this realistic? Is this feasible? With respect to the budget, okay, it says he needs $1,000, but he doesn't say for what. And then implementing from July to December, okay, that makes sense. Yeah, that's the 6 months. We don't know much more than that. I wish we knew more about resources and timeline. Now, we'd like to identify 3 different specific actions. So this is action 1, conduct a survey to understand how people think and feel about vaccines, especially COVID-19. So Simon has not done this before. He wants to do it with others. It'll take more than 4 weeks. He thinks this survey is innovative. I guess he's never done it before, but I'm not sure why, what would make this innovative. I don't see it. Doing a survey about knowledge and attitudes, is something that is common and in public health, and that is not new. So carrying out this research will enable me to understand what people think, feel, and act concerning vaccination. This will enable me to inform the development of strategies. Impact evaluation will be conducted. Okay, yeah. What is action 2? Okay, a training workshop to train community health workers on the importance of vaccine risk communication. And he has done this before. He'll do it with others. He thinks this is very innovative. Again, I don't see what's innovative about 1, a training workshop, and 2nd, vaccine risk communication. There is some new practices there around what some people call infodemiology, but I would question giving that a 5 out of 6. More about the action. So some immunization staff refuse to educate the people about the normal side effects of the COVID-19 vaccines. I see. Okay, this gets interesting. So we learn more about the situation. We didn't hear anything about, we've heard only that it's the sort of general attitudes with the COVID-19 vaccine being for adults. There do seem to be some specific dynamics there. And I wonder if here the goal is not too large. We have health professionals, the employment context recognized. We haven't heard anything about engaging the community as such. I suspect that's the 3rd action. We'll see. So when they experience changes in their system, so immunization staff, after taking the vaccine, they feel reluctant to come again, or are even convincing people not to come for the vaccine. Okay. Organizing this workshop would inform them about the needs to educate people first before they give them the vaccine. This would decrease the fear with side effects, increasing vaccine uptake. Okay, again, I can sense that Simon is a very logical person, connecting the dots between, so the logical framework, if you will, here. But it feels like there's something missing here about immunization staff. Will they be included in the survey? Might there be a need to specifically focus on them? Those are kinds of questions I would ask. Okay, and then action 3, engage community leaders, the municipal assembly, more especially assemblymen and women within communities in vaccine discussion through trainings. So he hasn't done this before. So that's surprising, but it also helps me to understand why the community only appears in an action and is actually central to uptake and acceptance of vaccines. I will do it with others. Again, the 5 out of 6 is on innovation. And Simon believes this can be done quickly in 4 weeks or less. So more about this action, engage community leaders. Here, political leaders and community leaders will be trained first to convince their citizens of the vaccine. So engagement and training, are they the same thing? Can this be done in less than 4 weeks? Do you have a training ready to go? Do you know how to do this? You said you haven't done this before. Similarly, healthcare workers themselves are not so much motivated for creating awareness and taking vaccines themselves. Okay, this goes back to health workers in the point about community. So this begs the question, if the community, and maybe this is what Simon is getting at, if community workers are not motivated, then how can you go and ask them to talk to the community? What else needs to happen? Strengthen communication and social mobilization strategies by involving influential leaders. Before they're included, training would be conducted. So there's a lot of training here, but there's a question about what that actually looks like, what will make the training effective. Okay, and so that is everything else that needs to happen around communication and social mobilization strategies. What the role of the data, what you will gain from the survey is unclear at this point. So that raises some interesting questions. And then sharing experience, yes, I'll prioritize doing this. Now we come to the indicators. So let's see what is here. So it's the Kajebi Dodi Health Facility. It's a rural area. And Simon knows the size of the vaccination target population. So it's got a very exact number. He knows the number of outreach sessions planned and held last year. So there were 4 sessions. The ANC coverage, okay, so is that 4%? So if only 4% of women have 4 visits, I don't understand this number for the care of pregnant women. Penta 1 coverage is 8%. Okay. Penta 3 coverage doesn't know. Measles vaccine coverage is 19%. And then first dose of COVID vaccine. Okay, these are very unlikely. There's something I'm missing here, but maybe Simon misunderstood because this is a very coherent plan. But if these are the indicators, there's actually more of an effort. The effort for COVID-19 vaccination has been more successful. That would call into question, if these numbers are actually this low, if Penta 1 coverage for the most basic vaccines is at 8%, something doesn't quite work here. Ready to take action? Yes, so Simon will join the accelerator if his plan is accepted. And then I seek to achieve at least 40% increase within this 4-week period. Okay, the training and the work meeting with the community leaders, the things that Simon has put into his plan do not in and of themselves lead to, none of the actions are about actually vaccinating people. So I don't see how within 4 weeks, I don't know what the 40% increase is, but if it's 40% increase in COVID-19 vaccination, there's some things here with the indicators that simply don't make sense. And that shows at the very least that Simon has a lot more thinking to do about his plan. And then the workshop to train community health workers on the importance of vaccine risk communication by next month. Okay, that's by next month, but I was asking in the next 7 days. So I think Simon probably was in a hurry by the end of this questionnaire, and probably did not carefully fill out the indicators or the specific 4-week and 7-day goals, because this is by next month, so it's 4 weeks, but we're asking for what will you carry out in the first 7 days of joining the Launchpad. So overall, up until we get to the indicators, a fairly credible effort focused on a challenge, a goal, actions that I would say are sort of process actions that may be necessary, but I would question, we would have to look at what methods are being used for training, and if really training is really the problem. Those are some of the questions I would ask. But these are questions for Simon to consider, and these are questions for Simon, to answer in his own context. I cannot know his situation. I can help him reflect. I can advise. I can share my experience. That is what we will do in the movement. But ultimately, this action plan is in Simon's hands.